My name is Janice Nicholson. I'm an RN. I've been an RN for 28 years now, and I work in cardiovascular intensive care at CDHA. We want the time to be able to interact with our patients, to ask them how they're doing. It takes time to assess somebody. Are you having pain? When the workload is really heavy, it takes away from the time that we can take teaching people on what they need to do to keep themselves safe, and the time to sit them up, to get them standing, to get them moving, so that they get the best benefit of what we can give them, all the teaching we can give them, so that they know how to look after themselves, especially when they're going home. I often tell patients, now you can't use your arms, you've had open heart surgery, so we have them hold a pillow over their chest. And they'll say, oh, that's going to be really hard to remember. And I'll say, don't forget, we will remind you, and we will remind you often, because we don't want you to hurt yourself. You have to be really good at organization to get your work done in a day, and you always have to be aware that because you're working in an intensive care unit or even in a hospital, that everything is not going to flow steadily every day, that you're going to have your ups and downs, and any patient that needs more help, extra care because they're sick, or you notice that something maybe isn't quite right here, and you really depend on your co-workers to come in, and if you have a second patient to look after, that they're going to keep an eye on that person for you so that you can concentrate on the one that's really sick. And if we're really short-staffed, that's really hard to be able to get enough people maybe to come to your bedside to help you. Maybe it's to cover your patients for you so that you can spend extra time with the patient that's not doing well, the patient that's a little bit sicker. And to help patients, and just think that, when people are ill and they need assistance, that somebody's doing something for them. The best part of being a nurse today, I think, is when you feel you have made a difference, and that's reinforced by what your patients say to you, that you've helped me, and that they're so grateful for everything that you do for them. One woman said to me, I just didn't want to lose my dignity, and I felt that I didn't.